be joined today on Health Beat by Dr. Andrew Baldwin, an ophthalmologist with Faith Regional Physician Services Ophthalmology in Norfolk. And today we're going to be talking about macular degeneration. So what is macular degeneration?
Absolutely. Thank you, Rob. Macular degeneration is a disease of the back part of the eye, in the retina. Now, if you imagine the eye like the camera, the retina is the film of the camera. Now, dry macular degeneration is very common. 30% of folks over the age of 70 have dry macular degeneration. And basically, our current treatments are don't smoke, take an eye vitamin pill twice a day, and that's going to be told by a person's ophthalmic provider, and to follow with an Amsler grid, a little grid we send a person home with. Now, a subset of people will go on to develop the wet form of macular degeneration. What occurs with wet macular degeneration is a person gets a leaky vessel in the back of the eye that leaks fluid into the retina. Now, fluid in the retina is like water in the basement. Water in the basement damages the basement, fluid in the retina damages the retina. The more water that's in the basement and the longer that water is in the basement, the more damage. Likewise, if a person has a crack in the foundation of their basement and water comes and goes into the basement, that'll cause damage as well. So our goal with wet macular degeneration is to get the fluid out of the retina and keep it out of the retina. Now, this sounds worse than it actually is, but what we do is we provide a series of injections of a medication into the jelly substance of the eye that helps reabsorb the fluid. Now, this is not just wet macular degeneration. This is for anything that causes leakiness of blood vessels. So leakiness from diabetic retinopathy, blocked veins, wet macular degeneration. We do injections to get that fluid out. Now, the very important thing about wet macular degeneration or macular degeneration, both forms, is it will impact a person's central vision, but a person will never go blind. And our goal is to keep a person to have good functional vision as long as we possibly can.
Well, that is terrific information. Thank you so much.
Thank you.
To learn more about clinic locations, specialties, and providers, visit frpsclinics.org.